What is going on, guys? I am Miguel from UCGym.com, bringing you the next episode of the Muscle Anatomy series, and today we're covering back. Now, the back is composed of many muscles, and of those muscles I'm covering 5, and I'm excluding the trapezius because it's a large muscle and I wanted to do a separate video for it. So I drew a diagram as best I could, and it was kind of complicated to draw it because there are so many muscles in the back and they are overlapping. So I did the best I could to draw the select muscles that I chose. So we have the lats, or Latissimus Dorsi, the Teres Major and Teres Minor, which are right here, and then the Supraspinatus and Infraspinatus, which are up here. Okay, so to explain what I drew here, this is the posterior view of the right side of a body. So here we have the spine, here we have the pelvic bone, or the ilium, and here is the Latissimus Dorsi. It's a very large muscle, and then here is the scapula, where these 4 muscle groups are located, and then here is the humerus, where all of them attach into. So to get into the origins, lats, they originate in T7 to L5. Now T7 stands for the 7th vertebrae of the thoracic vertebrae, and then L5 is the 5th vertebrae of the lumbar section of the spine. So it's about up here and then all the way down here, and then it also originates on the iliac crest. On some people, it varies on who you are or how you're born. So it can originate all the way down here in the iliac crest, but that just depends on if you were born with that large of a muscle. And then it also originates on the ribs and the lower scapula. So on the lower 5 to 6 ribs, and then the very bottom of the scapula, or your shoulder blade. Now for the Teres Major and Teres Minor, both of them originate on the scapula, same with the Infraspinatus and Supraspinatus, and then they all originate, or insert into the humerus, and yeah, that's pretty much it. They all insert into the humerus. So the humerus is a very large factor when it comes to doing your workouts for your back, because the muscle inserts there, and you have to use your humerus very consciously and knowingly that you are using it for your back, and you're trying to really work your back. So just, yeah, it all inserts into your humerus around up here. And then for the function of each one, for the lats, you have arm adduction, which is bringing your arms close to your body. And then we have scapular depression, which is depressing your scapula or bringing it down. So the most prominent or evident uses or function of the lats is when you're doing pull-ups or pull-downs or rowing movements, because you are contracting your lats when you do a adduction of the arm or bring it to the midline of your body, or the back midline of your body. Now the function for the Teres Major, you have arm adduction, internal rotation, scapular protraction, and depression of the shoulder. Now for adduction, it shares the same function as the lats. Then for the scapular protraction, if you do a lot of bench pressing, you've probably picked up on this method by now, where you sort of bring back your shoulders and squeeze your shoulder blades together to make your chest more prominent and get a better contraction when doing your workouts. So the Teres Major is a large contributing factor to the scapular protraction or retraction. Then internal rotation is, like I covered in the deltoid video, where you bring your thumb and you rotate it counterclockwise. That's internal rotation. Shoulder depression, your trapezius or your traps, they do shoulder elevation, where you shrug up, and then the Teres Major contributes to shoulder depression. So if you've ever done a if you're hanging from a pull-up bar or you're doing a lat pull down, if you just hold on to it and try to bring your arm down without bending the elbow, that's a shoulder depression or a scapular depression. So if you do that, you actually get a minor contraction through your back muscles. If you've reached the point of failure when doing your standard full range of motion pull downs or pull-ups, just sort of hang there and bring down your arm without bending your elbow, and you're gonna feel a good contraction to help you squeeze out the littlest bits of juice left. Now for the function of the Teres Minor, we have lateral rotation and humerus stability. Lateral rotation is the same as external rotation, where you bring your thumb and you turn it clockwise. So if you were to put your hand on your shoulder blade, so you gotta find your shoulder blade first, and if you were to keep your arm at your side and do external rotation, you're going to feel the muscles contract. Now the muscles that are contributing to that are the infraspinatus and the supraspinatus. These muscles are also factor in with external rotation and humerus stability. Now humerus stability is just stabilizing your arm when doing any movement. So all these muscles, they all share pretty much one major function, which is arm adduction and external rotation. So if you were to do, or if you want to develop your back to its fullest potential, you really want to emphasize these features or these functions in order to bring up a better back. So now for the exercises, normally I would do compounds and isolations, but there aren't really many isolations for back, since pretty much all of them are compounds. Now the back is put together a sort of pulling muscle. Now your biceps are also a pulling muscle. So to isolate the back, it's really hard to do since they both work together. It does insert into the humerus, so you can't really isolate it like you could with maybe the abs or a hip flexor. Kind of like with chest, since the chest does insert into the humerus, you can isolate it with doing pec flies, but you can't really do it doing reverse pec flies for your back, since it's more for your deltoids, and you can't really get a good contraction all the way back and down for the lats. So isolation is pretty difficult for the back, so you have to really depend on compounds. So I chose two major ones, pull-ups and rows. Now I did pull-ups / pull-downs, since they are the same thing. If you can't do pull-ups with your own body weight, then of course you can do assisted pull-ups on machine, or put a band connected to the bar and put your feet into it, and it's going to help you lift yourself up. But more preferably, you could do pull-ups, pull-downs, and you can change the resistance there depending on your strength. So with these pull-downs, there really is no technique as to how to do the most perfect way. So somebody asked me once, how do I do pull-ups, like where should I grab the bar? I told them you have to grab it as wide as you can in order to remove any elbow flexion. Now elbow flexion occurs through the biceps. Now if you eliminate that elbow flexion, you get less bicep involvement and you get more back involvement. So if you grab it really wide, your range of motion is kind of limited, since you are extending your shoulder blades pretty far and then you're pinching them back together. You don't really get that big of a range of motion. Now compared to doing a standard shoulder width pull-up, where you could do all of this, you're bending your elbow quite a lot. Now, I'm not saying that this isn't a really good exercise or grip length for the lats, but if you want to eliminate bicep recruitment, or you had like bicep tendonitis or a bicep injury, then grabbing it wide is kind of ideal for you. Now if you want to do, let's say, underhand grip pull-ups or pull-downs, now this is a really good way to recruit more muscles in your back. So when you're doing underhand, you're externally rotating your arms, and you're sort of stretching out your scapular, stretching out your muscles just a little bit more, and you're getting a better contraction. Now a lot of people don't really get full contractions when they're doing their back workouts. A lot of them stop where they feel like that's the best place, or they chose a weight that's so heavy they can't get a full contraction. Now picking a weight for doing back can be kind of tricky, because if you do a really light weight, you can't necessarily feel your back working, and if you choose too heavy a weight, you can't get a full range of motion, or you can't necessarily get in higher volume in order to induce hypertrophy. So picking the weight right for you is entirely on you. For me, when I do back, I choose a really heavy weight, because I feel like that's the only time I get the feeling that my back is working. Now if you choose a lightweight, then of course you can also do really high volume and get in just as good a workout, but it's all up to you. Now people sometimes underestimate what a full contraction is supposed to be, or they don't understand what it should be. So recently I watched a training with Kai Green video where he was training back with someone, and he showed him how to do a full range of motion where the bar has to touch your chest or sometimes your upper stomach. And I tried that, where I was doing lat pull downs with an underhand grip. So I came all the way up, and then I came down, and I realized this is where I normally stop, where the bar is pretty much a couple inches off my chest. Now, I dropped the weight and I tried to get a even deeper contraction, so I went all the way down. Now people don't really try this, and they should try it. When I did this, I immediately felt a deeper contraction. My back was more pumped up, filled with blood, and just felt better overall. Now, as for doing rows, you can do cable rows, dumbbells, and barbell rows. It all depends on you. You can do 2 dumbbells at the same time, or you can do a barbell, overhand grip, underhand grip, or you can use a one of those barbells that have a neutral grip in it, or any other sort of row. But the objective with the row is to go as low as possible. When you do a row and it's high, that's mostly for your upper back and your rear delts. Now if you go lower, you're getting a better contraction in your lats. Now the lats are sometimes harder to hit for some people, and they're certainly the muscle you want to develop the most, because you have so many muscles in your upper back. You have your rhomboids, your traps, your teres major, minor, supraspinatus, infraspinatus. All these are muscles on your upper back, but your lower back can mainly have the lats. So to really develop the lats, you have to do a lower pull towards your belly button. Now as for the grips, you can go wide, you can go close, overhand, underhand, whatever you want to do, but you have to focus on getting a full contraction for your back. And then, yeah, that's pretty much it. Yeah, so if you want to like really develop your back, or you want to induce more hypertrophy and build more muscle, you also have to do a lot of volume. Now, high volume training always works, whether it be for legs, chest, shoulders, abs, anything. High volume always works. Now, if you choose to go heavy, you're going to mostly develop strength. Developing your back is really important for your physique, because it creates a taper in your body, and also sort of makes your body look symmetrical, where you have everything well developed. You have your upper back creating that large massive muscle, and then your lower back really developed, creating a taper. That's really what you want to do with your back. So when you train back, training with high volume, change up your grips, never do the same thing over and over again, because your body gets used to it and you don't really develop as much as you'd like to do. So again, one more time, if you want to look, the lats, they originate in your spine and sometimes on your iliac crest, and it inserts into your humerus. The teres major and teres minor, they originate on the scapula, as do the supraspinatus and infraspinatus, and they all insert into the humerus. All of them help with internal rotation, external rotation, and arm adduction. So that's pretty much it. Kind of a weird video, but it's kind of hard to explain how all of this, comes together. So if you haven't seen the last muscle anatomy video, I'll have an annotation here you can click and you can watch it. And yeah, so if you want to see more things like this, head on over to UCGym.com and subscribe to our YouTube channel.
Yesterday, you said tomorrow, so just do it! Make your dreams come true! Just do it!